You're listening to BioTalk with Rich Bendis, the only podcast focused on the biohealth capital region. Each episode, we'll talk to leaders in the industry to break down the biggest topics happening today in biohealth.
Hi, this is Rich Bendis, and we're here for another edition of BioTalk. And we are fortunate today to have one of the new successful entrepreneurs who has just had a major success story he's going to tell us all about here in Montgomery County, Maryland. And it's Matt Mulvey, who's the founder and CEO of BeneVir Biopharma, Inc. Matt, welcome to BioTalk.
Thanks, Rich. Good to be here.
It is great to see you. And, you know, we've had a chance to meet probably over the last 7 years ago. And you reminded me a couple months ago that we had met actually in a BioBuzz networking event in 2012.
Yeah, so we met. I went to a BioBuzz event with my co-founder, Katie Saxtetter, and who's, full disclosure, also my wife. And we were there with a sales rep from a local company called ImQuest. And I just turned to the sales rep and I said, who should I get to know here? Who's like the big mover and shaker? And she pointed at you and she said, you need to get to know Rich Bendis.
Oh, my goodness. This is after being here for 6 months, Matt. So you'll have to remind me about that sales rep again and see if she's still around, because I'd like to thank her for that introduction. But a lot of people really want to know, how do you build a successful biotechnology business within Maryland and Montgomery County? And so let's talk a little bit about your personal background and how you ended up landing in Maryland, Matt.
So I grew up in Connecticut and went to college in Connecticut. Then when I was graduating from college, I had interest in using viruses as tools, and I wanted to move to New York. So I found all the people in New York who are working on viruses, and I settled on this one guy named Ian Moore at NYU, who was an assistant professor and was basically just getting his lab started. Then he had a very interesting paper in EMBO. So I met with him, and he offered a technician job to someone else. And then that person turned it down, and then he offered it to me. And so I basically became the first person in his lab. And we started working on herpes viruses, oncolytic viruses. And I ended up doing my PhD with him. And then I basically said, I'm sick of this stuff. I want to do something that really matters. So
what kind of stuff were you sick of?
Well, I was just sick of like kind of academic science and basic research. And I wanted to do translational research. So I decided that the place to do that was, of course, biotech. And I was going to waste my time in academia. I also wanted to work on healthcare solutions for the poor. So I found a company called Sequela, which was developing new drugs for tuberculosis, and they were here in Maryland. So I came down and met with the CEO, Carol Nacy, and we hit it off. So she happened to have a job opening at that point in time. And so I started working for Sequela, and that's how I came to Maryland. And then after about 5 years of working at Sequela, some events happened, and we decided that we should get back into oncolytic viruses. So Katie and I, who I was working with at Sequela, and Ian, founded BeneVir. And we had a choice to either locate the company in New York or locate it here in Maryland. And it just made sense to do it in Maryland. Greater access to experienced, especially, biotech and pharma experienced personnel, lower cost of living and operational costs. And
then you said we wanted to create a company. So that sounds simple. But at the end of the day, what was involved in creating BeneVir all the way from the start of the technology at NYU?
It's a relatively classic startup story. We had many years of academic research going into it. Probably the key event was that, when I joined Ian's lab, very few people were interested in oncolytic viruses, but we started publishing a series of papers about the mechanism behind a very exciting way of doing herpes virus, oncolytic viruses. And that eventually got picked up by a British company called Biovex that took our intellectual property, incorporated it into other aspects of what they were doing. And long story short, that eventually became the first oncolytic virus approved by FDA, and so far the most successful one. So basically, we had some issued patents and a lot of know-how and data in the academic environment. And so Katie and I had Katie had a lot more years in pharma than I did, or biotech than I did. But when that company, Biovex, got bought by Amgen in 2011, we were like, okay, this is just very clear. There is a path to monetization. Amgen has validated the space, so now it's time to start a company. And at that point in time, it's just find a lawyer, incorporate, get the license done. And then we started writing SBIR grants and getting angel investment and just did a slow build from there. We got 2 Actually, the majority of our SBIR grants were awarded when the funding line was 10%, so that was a good vote of confidence. We got some angel investment, did some proof of concept work, which led us to a Series A, and then the Series A led us to acquisition.
That sounds so easy, Matt, the way you explain it. But
well, the way that I always tell people is, in retrospect, it sounds easy, but at the time, what I was telling people, the way that we operated was, and I did not create this phrase, I picked it up from somewhere, but the experience was like flying a plane while building it. So it's, you're just scrambling. It's a scramble from day one to build operational infrastructure, get the research done, hire the right people, and monitor what's going on in the field so that you can be responsive to what the pharmas want and the VCs want.
I'm going to go back a little bit because a lot of people talk about how difficult it is to license a technology from a university. How was that experience for you in licensing the technology from NYU? And did they also try to negotiate that you would try to keep the technology and the company in New York City after the license was completed?
So I'll answer the last question first. No, there was really nothing about location. But as far as the licensing process goes, the tech transfer office at NYU was great. It's headed up by a guy named Abram Goldfinger, and then we also worked with a guy named Andrew Kootman, and those were the two people that we focused in on. And they were great. We walked in, we said, hey, look, I'm the scientific inventor. Ian Moore is also, who's a professor at NYU, is a scientific inventor. We're founders of this company. This is our technology. We know it backwards and forwards. And we've got this great path to monetization established by the Amgen transaction. So it was pretty much a no-brainer. And they worked very closely with us to draft a license agreement that was acceptable to both parties and get started.
Great. And then also you mentioned you were working for Sequela and Carol Nacy, who's a great entrepreneur in this region, been one for a long time. What was her reaction when you said, hey, I want to start up a company?
Her reaction was very supportive, let's put it that way. At that point in time, Sequela was and still is very focused on their clinical stage company. And so I'm a preclinical guy mostly. So it was basically just, we said, Carol, look, we've got this opportunity. We still have projects at Sequela. We can keep those going. We can get this thing started and let's take over some of the lab space and we'll do it, keep working together and moving forward together.
So you had a great partnership with an existing entrepreneur in the region, actually probably a little mentoring about what to do and what not to do, and also was willing to share some of her wet lab space with a new emerging biotechnology company, which is sort of playing it forward.
Yes. Carol and Leo Eink, who are the founders and the people who run Sequela. As you mentioned, they are, especially Carol, is pretty well-known entrepreneur in the area. And yeah, so.
Super.
Yeah.
That's the way it's supposed to work, very simply. You mentioned oncolytic viruses. Probably a lot of listeners don't know what you're talking about, Matt. Can you explain that, please, a little bit?
So oncolytic viruses are basically live viruses used as drugs. So mostly what these things are used for is you take this virus, inject it into a tumor, and it basically kind of stimulates the immune system to infiltrate the tumor. And the immune system coming in looking for the virus, but then when the immune system gets there, it's like, this is a tumor. And so it can lead to the generation of T cells against the tumor that can then ideally go out and scour the body and eliminate all the residual disease. And that's been absorbed in some patients as a monotherapy. But really where the field is going is combination therapy with other immunotherapy agents. And the idea is that what's interesting right now is that people are starting to realize that oncolytic viruses can actually be the foundational elements of immunotherapeutic combination regimens to get the immune system mobilized against the tumor and allow other drugs to work for more patients.
And what's the status of your technological progress to date?
Moving ahead of schedule and under budget. The status is, BeneVir, we developed a platform of viruses that can evade clearance by the immune system. And when we have the technology to rapidly generate very complexly armed viruses. So it's still preclinical, but one of the main reasons that we were acquired was that it's very clear that this is a platform technology that can be mobilized to treat many different types of cancers. So it's still preclinical, soon to be clinical in multiple different tumor types.
Yeah, and you just mentioned acquired, which I haven't even mentioned yet. But that's
okay.
That's really why you're here today, to talk about that success. But before we get into that acquisition by Janssen, the pharmaceutical companies of Johnson & Johnson, which we'll go into a little more detail about later, let's talk about the funding history for BeneVir, which is always a challenge for emerging biotechnology companies.
Yeah, funding was a big challenge for us. I mean, as I mentioned before, we started off with a very slow build. We incorporated the company, and then we started writing SBIR grant applications, and they were awarded. And then that allowed us to get operations going and do some proof of concept work. And then that led to the Series A. And the Series A came, we talked to a lot of different venture capital companies. And, the ones that would give us meetings, half of them were kind of like, well, we took this meeting because, we just want to learn about oncolytic viruses. We're not really sure we want to invest. And the other half were like, we're very interested in oncolytic viruses, but we want you to be clinical phase. It's a classic story of venture capital being more late phase. And eventually what happened is within my network, we had a connect. I mentioned Andrew Koopman at NYU before, and he had connection to kind of unknown group of basically private equity people in New York that were interested in doing healthcare investments. And so he put us together and we hit it off. So that's where our Series A came from, was a company called Pansend Life Sciences, which is a subsidiary of a public company called HC2. And they have investments mostly in medical devices, and we're their only therapeutic IO investment.
So if you're the only therapeutic for Pansend investment, what was it that they found that intrigued them about you versus other things that they looked at, and why would they take the risk on you?
Well, you'd have to ask them, but what they tell me is they knew this area very well. They think that this area has a lot of undervalued and untapped potential.
And what this area are you referring to?
Biohealth capital region,
Maryland, D.C., Virginia.
Yeah, but especially Montgomery County. And so they know the area well, and they know that. So they're private equity, right? So they're looking for undervalued investment opportunities. And so if you want overvalued investment opportunities, you go to Boston and San Francisco. If you want undervalued with high potential for ROI, you come here. So they liked that we were connected to them through NYU, so we were within their trust network. 2, we were clearly undervalued. And 3, what they'll say is that they mostly believed in my experience and knowledge in the field, and they understood what we wanted to do with the platform. And then later on, they told me that they would have made the investment much sooner if they had known that my wife Katie was involved in the company.
Okay.
So she wasn't at the first couple meetings. And
they saw the true value of
when
the
they
company.
saw the true value of operational expertise.
And were they like a traditional venture capitalist that was more hands-off and passive?
No, they were actually very involved, which was very good for us, especially being a scientist-driven company. I don't have an MBA. I just have a PhD. So that's another reason why venture capital wasn't really interested in us, is that we didn't have the experienced senior management on board. So we essentially brought that on board with our investors.
And was it their idea to look for strategic partners in the pharma and the bio world, or was that your idea?
I mean, it was, yeah. You start doing that from day one,
right?
So yeah, I mean, as we were building the company and everything, one of the major things you have to do is you're always developing the exit. So we were always looking at, developing partnerships with pharma, developing partnerships with later stage investors, and just, working that network. Yeah, we were doing that from day one. It wasn't my idea, it wasn't their idea. It was just the obvious thing to do.
And then how did the Janssen relationship evolve?
Over many years. I mean, the history of it is that even before we had the Series A, when we were negotiating the Series A in the summer of 2014, BeneVir got enrolled in TEDMed Hive. And so we were at TEDMed Hive here in DC. And, so there's a booth there, and people came by the booth and were like, what are oncolytic viruses? And this one person from Janssen came by and said, hey, I think oncolytic viruses are great. We should talk. And so that started off a relationship. So I got his contact information, emailed him, and he was like, oh, you should talk to this other person who's kind of head of BD. So I started talking to that person. And this is kind of where biohealth innovation came in, is that we were working with Ram Iyer, who was helping us source investment through his network and also helping us, giving another eye to what we were doing, how we're marketing ourselves. And it just turned out that Ram knew the business development guy at Janssen. So Ram was basically like, you should pay attention to this. So again, it's like increasing the trust, working within that
it's
kind of trust
real
network.
Deal.
Yeah. And so that was 2014. And basically like nothing happened. We met this business development guy. I met him at JP Morgan. It actually did not go well the first time. It went so badly, actually, that he remembered me. And it was actually a very antagonistic meeting. But we parted that meeting on relatively good terms. But I basically kept running into him at all the conferences over the next several years. And so So he got to know me and he got to trust me and understand what we're doing. And also, Ram was constantly badgering him and being like, you need to pay attention, you need to pay attention. And so basically when Janssen decided that they were going to go into oncolytic viruses, we were at the top of the list because they knew and trusted us. So then the diligence started.
And was this an exclusive relationship with them, or were there other companies you were talking to at the same time?
Basically, when Janssen came to us and said, let's talk seriously, we had a couple months before that had started our own official kind of partnering effort. We hired a firm called Destim, specifically 2 people in that company we wanted to work with, which is Michael Casey-Cosard and Jason Laffin, who are now at LifeSci Advisors in New York. But we started working with Casey and Jason, and it just kind of all started simultaneously, like a full scale, just kind of going out and marketing ourselves and then dealing specifically with Janssen and another company that had come to us through my network. And that process proceeded, those 2 processes, well, 3 technically, Janssen, another company through my network, and then everyone else proceeded all in parallel.
And do you think that outward marketing of BeneVir triggered anything within Janssen to say, hey, we better look at this more seriously?
I have no idea. It's not like I was telling them, like, I'm talking to this company and I'm talking to this company. And if I put myself in Janssen's perspective, in their shoes, and look at how a process went, it seemed like we were just talking to them.
Yeah.
But there was a lot going on.
And how did the magic moment happen?
Oh, that's a good question. There were several magic moments.
Let's do this thing,
The magic moment was basically when, I can't really go into the details of it, but there was a meeting and the terms were laid out and we said, these are acceptable. So that was, I guess, the magic moment. But for me personally, it was probably the first moment that I pretty much knew that we were going to go with Janssen was the first major meeting of the scientific team. So the scientific team came down to Maryland. They met us in our offices, in our boardroom, which could really only fit 5 people, but there were 15 people in the room. I think 11 people actually. And it was a 4-hour meeting, and there were just various connections between like Ian and their virologist who knew each other and respected each other, and the other people on the team that I had known and gotten to know through various meetings. And then we laid out what we were doing, and they laid it out what they wanted to see, and it was just like, this just made perfect sense. So the science made sense, and the relationships made sense, and the people, most importantly, the people on the Janssen side made sense. Like, I don't really want to go into details, but we had similar meetings with other companies, and the people were, let's just say, we didn't want to work with them.
They weren't Janssen-like.
They weren't Janssen-like.
Yeah. Okay. And then from the date of that meeting that you had to the date you actually closed the transaction, how long did that take?
That meeting for me, that first scientific powwow was April of 2017, and then the transaction was signed in May of 2018. Okay, so a little over a year.
Yeah, 13 months.
Yeah.
Really not too bad, really. But it was probably like a lifetime for you, right?
It was a lot of work.
Right.
And the other thing that happened in that time was, like in April of 2017, my wife and I have a 1.5-year-old. And then on June 20th of 2017, our second boy arrived. And so it was this, I don't really remember a whole lot of the process.
Yeah. You were busy.
Yeah, we were very busy.
Well, you keep mentioning Katie. Tell the listeners a little bit about Katie and what it's like to have a wife as a partner in a business, especially a very technical biotechnology business.
Yeah, it's great. A lot of people are like, they're like, how do you do it? Like you wake up and you get the kids off to school, and then you go to work. You get the kids, you come home, cook dinner, go to bed, get up. It's all 24.
Groundhog Day.
24/7 of being together. But it's great. Katie and I, basically the first day that we started working together at Sequela, we knew that we would work well together, and then it's just been like that for the last 11, 12 years. But as far as we're actually running the company, when you're doing a company like this, especially in the startup phase, you really got to know that the people you're working with are committed and are dependable and can deliver. And so, I knew that about Katie. I'm not sure Katie really knew that about me, but it was just, it's a key to our success is the relationship between me and Katie.
Well, this has been a very big story for the region to see a nice major global company enter and really recognize the quality of the research that's going on in the biohealth capital region and the quality of the entrepreneurs down here. So what has Janssen's commitment been to you, Katie, and the team about keeping you in the biohealth capital region, and what do you see as the prospects for the future for your growth?
Our plan is to grow BeneVir in place. I mean, what we do at BeneVir, no one else can do at Janssen. Like, that's part of the reason why it's an acquisition. And so there's really no reason to move the operation closer to, out of the area. We've invested a lot of time and energy in hiring the right people, training them, and getting the operation going, getting it to a point where it can scale. To move it out of the area, I think would just serve no purpose. And I think, Janssen agrees with that. So the plan is that's why we, 2 months before the deal was signed, we moved into a new space that was, specifically built out for us and for what the kind of work that we do, and was dramatically larger than our startup location. And
more than the bench in the back of Sequela.
Yeah. Well, we started with the bench in the back of Sequela, then we moved to basically a 6,000 square feet place on First Field, which was great. And then we moved to significantly larger space. And we're only really, even now, after the transaction, and we've been hiring, we're only taking up like 40% of that. So we're planning to grow to basically double in size. Yeah.
Was it nice to have real estate available to accommodate your growth and stay within sort of the same landlord?
Yes, it was good. We originally had a landlord, as part of Sequela, and then when we got our next location, we were with Alexandria. And Alexandria has such a great large portfolio in the area that as we grew faster than we expected, frankly. So it was nice to be able to say to Alexandria, like, we're going to trade up. And they're like, great.
Yeah, and one of the keys of building a successful biotech company is having access to all of the resources you need to grow your business. So that's the people that you need for the company, the professional accountants, lawyers, regulatory professionals, and everything you need that you might have to turn to for advice. How has that been from an experiential standpoint for you in growing BeneVir here?
Almost all of our third-party consultants and contractors that you need to start a company, get it going, were all references through people that we knew here and that we trusted here in this area. So, for example, when we started the company, we started working with a corporate firm out of Boston, and they were terrible. I mean, terrible. And so I went to the law clinic at University of Maryland, and I said, these people are terrible, but I don't have a good idea where to go. And they were like, you need to work with this guy in this place. And so we met Fred Davenport from Murchison, Taylor & Gibson, which is actually a company in Wilmington, North Carolina. And he was fantastic. And so he became our corporate attorney, and it was just like perfect. And then when it came time to bring on IP counsel, independent IP counsel, we turned to the greatest resource for networking in the state of Maryland, which is Biohealth Innovation, run by Rich Bendis. And you put us in contact with, or technically Ram, and you put us in contact with Michelle Wales, who's been great and has handled our IP moving forward. And then, of course, the business development work that Ram did for us through BHI was great. Yeah.
Great.
So, sorry, does that answer the question?
No, it answers, yeah. It's a good region to build a company, and you can find most of the resources that you need right here.
Yeah, and I think it's a big emerging region. And I think, the tagline is top 3 by 2023. I do think that that's very attainable. I think, you look around and what's happening here, like the amount of capital that's coming in here, the cranes that are up building housing, affordable housing where you can raise your kids, the schools. I mean, the region really does offer a lot that you can't get in other places. And I think the gaps that, the things that kind of hold us back compared to Boston, San Francisco are rapidly going away, especially when you look at how much capital is coming into the region.
Yeah, it's amazing the size of the transactions and the number, how they've increased, as well as major global players who are establishing a presence right here in this region, which were not here before.
No, for example, like Janssen, yeah.
Yeah, they had no physical presence, and now with you, it's their footprint. It's basically how they can build down in this region.
Yep.
So as you enter this next chapter of your life, as an intrapreneur within Janssen, what would you say to other entrepreneurs out there who are trying to build companies like yours? What would you do differently, or what were some of the things you did right to get to where you are today?
I don't think we did much that was right. I think it was a big learning process. And I think honestly, I think anybody who tells you that they did it all correctly their first time is wrong. They're just lying. But we did a lot of things wrong. The advice that I would give is, it's just very basic advice. I mean, you should look at like what iCore is doing, what that kind of training does, So what I tell people is, especially as scientists, entrepreneurs. So in science, when you're trained as a PhD at the bench and all this stuff, you're moving from experiment to experiment, and where does the research lead you? And that is not a good way of doing a company. You have to flip that process on its head and think, what's the final step? Where do I want to get? Commercialization, what are the patients? And move backwards. So build a plan from the finish line back to the starting line. And once you build that plan, then that's a good place to start. And then you start filling in the details of that plan as you move forward. But I've been told that that's actually good advice for scientists, entrepreneurs, is because when you are focused on what the goal is and you have a clear focus on that and how you fit into the broader market, that vision is what investors and pharma are looking for. Because what they're looking for is they're looking for people who know how to run companies, and the way that they know how to run companies and do technologies is that you're clued into the same picture, the same paradigm that they're clued into. And so you can be a good conversation partner, and you are basically telling them that your plan is what they're looking for, and your plan will solve the problems that they have. And I think that that's very important to realize when you're starting a company is you have to think, and this is what like iCore will tell you, is you have to think about who the customers are. The customers are the pharma companies that will ultimately buy your product, clinicians that will ultimately prescribe it. But in the near term, it's, venture capital, investors. What do they want to see? What are they looking for? And you have to understand what they're looking for and then find a way to pitch your technology in your company to them.
And when you talk about the investors, how do you stay true to your mission when you're also trying to cultivate these funds to be successful in what you're doing, where people that have the money may not be in agreement with your philosophy?
Most people are not going to be in agreement with your philosophy because nobody knows the future, right? And so all the investors, all the different VCs, the high net worth investors, they all have different concepts of what the future is. And so they're all different customers with different needs, right? And you just have to work really hard to try to understand what their vision is and how they're seeing the future and what they want to invest in and how you can communicate to them that what they're looking for is what you are pitching. So the vast majority of people that you talk to, you can't change what you are to fit that particular person, but you have to try to communicate efficiently what your vision is, understand what their vision is, and go through enough people, or at least use your network to find the people whose vision is similar to what your vision is so that you can meet them and get a deal done.
Congrats on staying true to your vision because it's worked so far, right?
Yeah, we got a lot of help from Biohealth Innovation as far as properly communicating the vision and making it efficiently and properly communicating it, which is something that I was not doing well. But the vision didn't really change that much. It was better presented, but it was still like our original vision of a platform technology that would synergize with the immune system and with IO agents.
Before we close, Matt, anything you'd like to share with our listeners, any wisdom about what it takes to build a successful biotechnology company?
Well, if there's any wisdom to it, it's you have to have full commitment from the people that you work with. And so our particular story is that, it was a husband-wife team that founded the company with my PhD mentor, who was basically the first person in his lab. And we've been working together for 20 years. So we knew that those were good people to work with. And then our first employee was this guy, Steve Furman, who has been working in the area for quite a while in a lot of different companies. And we could tell immediately it was somebody who could get things done. So like having that core of people who can produce work product, I think is very important. And none of us were really like household names at the time. He is now, basically. But find people that are committed to your vision and that are incentivized and can execute. And then you have to reach out into your networks and into your region. And I think that's here in Montgomery County, it's, and the way it's developed over the last 10 years is pretty fantastic. But we found everything that we needed here. A lot of it came through BHI, some of it came through other organizations. But you have to reach out and find the people that can do the things that you can't do, and try to find the people that can, like the employees that you hire, the people that you start the company that can deliver. So for example, like with Biohealth Innovation, before I met you at BioBuzz, we were working with other groups, not to be named, who were just kind of like, they'd give us some advice, but they weren't really committed. But then your model is the people who work at BHI are incentivized to actually produce work product. And so we got a lot of help from you. And I think that's a good model. So work with people that can actually get things done.
Well,
sorry.
Very good words of wisdom, though. And it's something that is, if you don't have the knowledge or the networks internally, you got to find out the people that do. Find people you trust, build good partnerships, and get people involved that are willing to stay with you during the good times and sometimes the rough times, which happens through every entrepreneur's life. So we really have enjoyed this edition with Matt Mulvey, the founder and CEO of BeneVir Biopharma Inc., a newly minted subsidiary of Janssen. Matt, thanks for being on the show.
Thanks for listening to BioTalk with Rich Bendis.